Welcome to the Deep Dive. We're the podcast where we take a stack of information and really get straight to what matters.
That's the goal.
Today, we're plunging into the world of endurance horses. These are incredible athletes, right? Covering sometimes over 100 miles in a day.
Truly extraordinary animals.
But with that incredible performance comes, well, a hidden risk, fractures. And we're not always talking about those big, dramatic breaks you might picture. Often they're more subtle.
Yes, progressive injuries.
Exactly. So our mission today is to unpack why these happen, how they're found, and crucially, what can be done to prevent them.
And it's fascinating because, the demands of endurance create really specific injury types, different from other horse sports.
Right.
And our understanding, it's constantly evolving, especially with the sport growing so fast globally.
Okay, so let's dig in. When we say fractures in these horses, what exactly are we looking at? It's not just the obvious stuff.
No, not always. I mean, fundamentally, a fracture is a break in the bone's continuity. But for endurance horses, the really key type is what we call a stress fracture or a fatigue fracture.
A stress fracture.
Yeah, these aren't usually from one big impact. They're from repetitive submaximal loading.
Submaximal. So, like, not full out galloping all the time.
Exactly. It's that continuous lower level stress. Think hours of trotting, cantering. The bone's natural repair process just can't keep up.
Ah, okay.
So microscopic damage builds up. It might start incomplete, like a tiny crack, but if it's ignored, it can definitely become a complete break.
So it's like bending a paperclip back and forth.
That's a great analogy. It's very different from a sudden traumatic break or a pathological one from disease, which, are pretty rare in well-managed endurance horses.
Right. So this cumulative damage, it's almost invisible at first. Why are endurance horses particularly prone to this specific type?
It really boils down to the sport itself, that
Yeah.
prolonged submaximal loading, hours and hours.
Over varied terrain, too, right?
Absolutely. That's very different from, say, this short, intense bursts in racing. This continuous loading, often on different surfaces, some hard, some maybe uneven. It creates cumulative stress,
Okay.
especially in the lower limbs and the pelvis. And then there's the metabolic side.
Metabolic, how so?
Well, dehydration, electrolyte imbalances.
Mm.
These happen during long rides, and they can actually impact bone health, its ability to repair itself.
Wow. Okay. That adds another layer. And you mentioned the sport's growing. Is this problem getting more common?
It seems to be. Endurance is actually the fastest growing FEI discipline,
FEI.
the International Federation for Equestrian Sports.
Got it.
And as training gets tougher, speeds increase.
Mm-hmm.
We're seeing more of these fractures. They look a bit like some stress fractures in racehorses, actually.
Interesting. Is it worse in certain places?
We tend to see it more in areas with those really flat, fast courses. Think parts of the Middle East, South America.
Okay.
But honestly, we're recognizing them more and more everywhere, including Europe.
And what about the horses themselves? Any particular type?
Overwhelmingly, we see Arabians and Arabian crosses. They're just built for this.
Right.
Age-wise, they can compete young from 6 and go into their late teens. But the horses most often affected tend to be maybe 10 to 18 years old.
Mature athletes.
Exactly. And interestingly, no real difference noted between males and females, and no clear genetic link found so far.
Okay, so we know what they are and why the sport sets the stage. But the actual cause in an individual horse, it sounds complex, not just one thing.
Oh, absolutely not. It's profoundly multifactorial. Always.
Multifactorial.
Yeah, it's this mix of factors intrinsic to the horse, their body, their health, and extrinsic factors.
Like training, environment.
Precisely. Management, environment, training load. All of it plays a part.
Okay, let's unpack that. Starting with the biomechanical overload. The footing, how they move, how does that contribute?
Well, repetitive strain is the big one for stress fractures.
Yeah.
And footing is huge.
Hard ground.
Hard ground, concussive surfaces. They increase the impact forces going up the leg dramatically.
Makes sense.
But interestingly, really deep, heavy footing, like deep sand, can also be a problem.
How so? That seems counterintuitive.
It increases the strain on tendons and ligaments. And as the horse struggles to pull its feet out, it puts immense stress on the bones, especially the pelvis. We see a link there.
Wow. Okay. Deep sand and pelvic fractures.
And uneven ground obviously adds twisting forces. Then there's pace. Even though it's endurance, maintaining a pretty brisk pace for a long time, especially over, say, 80 kilometers, that definitely ups the risk. And fatigue. Fatigue is a massive factor.
Fatigue, how does that specifically impact bone?
As a horse gets tired, its gait changes. It becomes less efficient, the impact forces can increase, load distribution gets altered.
Making the bones more vulnerable.
Exactly. Much more susceptible to injury when they're tired.
That's fascinating. So a tired horse is biomechanically different, making them riskier. Beyond the actual riding, what about the horse itself? Its conformation, its management?
Oh, they play a huge role. Huge. Horse-specific things. Even subtle conformation issues like slightly imperfect limb alignment can change how forces are spread.
Right.
Individual bone density varies. Age matters too. Young horses still maturing, older horses maybe with some wear and tear or slow repair.
Yeah.
Both can be higher risk.
Okay.
And fitness level, or rather inadequate fitness, that weekend warrior thing.
See how much too soon.
Exactly. Huge risk factor. Body weight, obviously heavier horse, more load. And diet. Deficiencies in calcium, phosphorus, copper, zinc, even vitamin D or protein. That compromises bone strength.
Nutrition is key.
Absolutely. Hormonal status in mares can play a role. And even a history of previous lameness can subtly change how a horse moves, overloading other areas.
So many individual factors. What about the management side? Training schedules, rest?
Critical. Inadequate conditioning is a big one. That too much, too fast, too soon approach just doesn't give bone the weeks or months it needs to adapt.
Bone adaptation takes time.
A long time. And lack of variety in training. If you only train on hard ground, the bone adapts only to that. Mixing surfaces helps build stronger, more resilient bone.
Cross-training for bones?
Kind of, yeah.
Yeah.
And insufficient rest. Between hard workouts, between competitions, and actual off-season. Bone needs that downtime to remodel and repair.
Makes sense.
Then there's shoeing and hoof care. Imbalances, long toes, underrun heels, they can totally change limb mechanics.
Throws everything off.
It really can. Even poorly fitting tack or an unbalanced rider can create uneven loading.
Okay.
And this leads to something really, really critical. A major cause, a major risk factor we absolutely have to stress.
Okay.
It's continuing to train or compete on a horse that isn't sound, especially if you're masking pain with painkillers, whether systemic or local blocks.
Masking the pain.
Yes. Doing that. It's not just risky, it's almost inviting a catastrophic injury. You're overriding the body's warning signals.
That's a really sobering point. Okay, so given all these factors, where do these fractures tend to show up? What are the common spots on an endurance horse?
Well, they can vary. Down in the lower limbs, we see them a lot in the fetlock joint, that's like the horse's ankle,
Fetlock, okay.
and the cannon bone just above it. Also the coffin bone inside the hoof and the hock joint.
So distal limbs mostly?
Often, yes. But we're also increasingly recognizing fractures in the pelvis.
The pelvis, up higher.
Yeah, the big bones around the hips. Iliac wing, shaft, pubis, different parts, especially, as I mentioned, in horses training on deep sand.
Right, the deep sand connection.
And these pelvic ones can be just on one side, sometimes both.
Bilateral.
Exactly.
Yeah.
And beyond those, we do sometimes see stress fractures in the bigger bones, higher up, tibia, femur, humerus, upper leg bones.
Okay, so quite a range.
Definitely. And there's a specific complication related to location, I should mention. Some fractures near the fetlock, in the cannon bone, they might actually be bilateral, affecting both front or hind legs.
Both legs.
Yes, but the horse might only show lameness in one leg.
Wow, that's tricky.
Extremely. It means if you're planning surgery, you absolutely must x-ray the good leg too. Otherwise, the horse could put all its weight on that compromised leg during recovery from anesthesia.
And cause a catastrophic break on the other side.
Precisely. It's a critical safety check.
Okay, that's vital to know. So if these stress fractures can be subtle, maybe even bilateral but looking unilateral, how on earth do you diagnose them? What's the detective work like?
Well, the signs definitely depend on if it's a stress fracture versus a complete one.
Right.
For stress fractures, it's often, subtle, insidious onset. The lameness might get progressively worse with work, better with rest, or it could be intermittent lame one day, sound the next. Vary. You might just see poor performance. The horse doesn't want to go forward, stride feels short, just feels off. Maybe subtle heat or swelling over the bone, but that's hard to detect with deep bones like the pelvis. Sometimes pain if you press right on the spot.
Okay, and complete fractures.
More obvious, much more obvious. Usually acute, severe lameness. Often the horse won't bear any weight. Obvious swelling, maybe deformity. You might even feel crepitus, that crackling feeling, and intense pain.
Right, big difference.
Huge. So diagnosis always starts with a really thorough lameness exam, watching them move, flexion tests, palpation.
A standard workup.
Exactly. But then we get to imaging, and here's where it gets interesting. Radiography x-rays, they're essential, but
But?
they're often not great for early stress fractures. The fracture line might not be visible for 2-3 weeks, sometimes longer.
So the X-ray might look normal even if there's a problem.
Correct. Early on, yes. That's why nuclear scintigraphy, or a bone scan, is really considered the gold standard for picking up early stress fractures.
Bone scan, how does that work?
We inject a safe radioactive tracer. It goes to areas of active bone turnover where the bone is trying to repair itself. These areas show up as hot spots on the scan.
Ah, so it shows metabolic activity.
Precisely.
Yeah.
It's very sensitive, great at locating where the problem is. It doesn't always tell you the exact type of injury, but it points you right to the spot.
Okay, bone scan is key for early detection.
Absolutely. Now, a really critical caution about diagnostic analgesia: nerve blocks, joint blocks.
Using painkillers to locate the lameness.
Yes. If you suspect a stress fracture, using blocks is extremely risky.
Why risk?
Because if you block the pain, the horse might suddenly feel comfortable enough to put full weight on that weakened bone.
Leading to a complete break.
Exactly. Potentially catastrophic. So if a stress fracture is on the radar at all, advanced imaging like a bone scan should come before any blocks.
Safety first. Got it. Are there other imaging tools?
Yeah, ultrasound can be useful for some superficial bone issues, like in the pelvis. And CT or MRI give amazing detail, especially for surgical planning or looking for really early changes like bone marrow edema.
Okay, quite an arsenal. So once you have that diagnosis, what are the treatment options? How do you get these horses healing?
Well, it really depends heavily on the fracture itself, type, location, severity, and, what the goals are for the horse athletically.
Makes sense.
For most stress fractures, the main approach is conservative management.
Meaning no surgery.
Generally, yes.
Yeah.
The cornerstone is strict stall rest, usually 2 to 4 months.
Wow, that's a long time.
It can be.
Yeah.
And for pelvic fractures or fractures higher up the leg, it might be even longer, 4 to 6 months sometimes. You have to remove that mechanical stress so the bone can heal.
Okay, rest is key. What else?
After the rest period, a very careful, gradual return to exercise, controlled rehab, things like hydrotherapy, underwater treadmill. Swimming can be great early on.
Keeps them fit without the pounding.
Exactly. We might use NSAIDs, anti-inflammatories, for pain initially, but cautiously. Prolonged high doses can actually slow down bone healing.
Oh, interesting. So careful with the painkillers.
Very. And supportive shoeing can help too.
And what about the more severe cases? Complete fractures.
For complete fractures or maybe some stress fractures that are high risk for displacing, surgical management is often the way to go.
Surgery. What does that involve?
It can mean internal fixation, using screws and plates to stabilize the bone fragments, especially if the fracture involves a joint or is displaced.
Okay.
Or sometimes external coaptation, like putting on a cast or splint, mainly for lower limb stability. Minimally invasive techniques are also being used more now.
Now, you mentioned earlier the unique physiology of endurance horses. How does that factor into treatment, especially around surgery?
Ah, yes, this is absolutely critical. Life or death critical sometimes.
Okay.
Endurance horses, especially after competition, are often significantly hypovolemic, low blood volume, and dehydrated.
Right, from the long distances.
Exactly. And you must, absolutely must, correct these fluid deficits before you ship them for surgery or put them under general anesthesia.
Why is that so vital?
Anesthesia itself can lower blood pressure.
Right.
And if they're already dehydrated with low volume, it can lead to severe complications like poor organ perfusion, kidney damage. It's incredibly dangerous.
So, fluids first. How much?
It's routine to give at least 10 liters, often more, of IV saline. We monitor their blood work, like hematocrit, closely to guide it. Rushing this is a huge mistake.
Okay, fluids first. Monitor carefully.
And related to this, here's that critical contraindication again with NSAIDs.
The painkillers.
Yes, giving NSAIDs to an endurance horse before you've corrected their hydration and checked their kidney function, it can cause acute renal failure, kidney shutdown.
Oh, wow.
So it's absolutely contraindicated unless you know their hydration is good, their creatinine levels are normal, or you've already given those IV fluids.
That's a huge takeaway for anyone managing these horses post-ride.
Massive. And one more point on fluids: using a nasogastric tube, putting fluids directly into the stomach, is generally not recommended for endurance horses.
Why not? Seems like an easy way.
They're prone to ileus, where the gut shuts down, and, terrifyingly, gastric rupture. The risk is just too high in these often stressed, metabolically challenged horses. 4 fluids are much safer.
Okay, IV fluids are the way. What about other therapies? Shockwave? Stem cells?
Yeah, adjunctive therapies like bisphosphonates, shockwave, PRP, stem cells, they get discussed. The evidence for their direct benefit in fracture healing itself is often variable or still being researched. They might help with associated soft tissue issues or pain, but the core treatment is rest or fixation.
Got it. And sadly, sometimes the injury is too severe.
Unfortunately, yes. Euthanasia has to be considered when the prognosis is hopeless. The main thing then is preventing suffering.
Of course.
And importantly, horses with really severe, irreparable injuries shouldn't be subjected to long transport. A second opinion is good if it's practical and doesn't cause undue delay, but welfare comes first.
Absolutely. It really highlights how interconnected everything is: training, nutrition, hydration, management. So, looking ahead, what's the prognosis typically? Can these horses get back to competing, and how do we stop this happening?
Prognosis. It really depends. For stress fractures, especially if caught early and managed well, the prognosis for the bone healing is generally good to excellent.
That's encouraging.
It is. Pelvic stress fractures, for instance, often carry a good prognosis for returning to work. However, the return to their previous level of performance can be variable. There's always a risk of re-injury.
Okay. And complete fractures.
That's tougher. Prognosis for return to high-level performance is often guarded to poor, especially if it's a fracture involving a joint or a major long bone. Sadly, they can often be career-ending.
Yeah.
Key factors are always fracture type, location, severity, how early it was diagnosed, and how well the owner complies with the long rehab plan.
Right. Compliance is key.
Definitely. And an interesting observation is that fewer endurance horses seem to return to their former competitive level after these injuries compared to, say, racehorses.
Why is that?
We don't fully know. It could be their age, maybe
Yeah.
the sheer demands of endurance training make a full comeback harder. It's still a bit unclear.
Okay. But the big message here seems to be prevention.
Absolutely. Prevention is paramount.
Yeah.
And it has to be a holistic, multifaceted approach.
So what does that look like?
Number one, gradual, progressive conditioning. Slow and steady wins the race here, truly. Build that aerobic base and bone strength incrementally. Remember, bone needs weeks, months to adapt.
Patience.
Loads of patience. Long, slow-distance work, hill work. That's fantastic for building bone strength safely. Number two, varied training surfaces.
The cross-training idea again.
Exactly. Train on sand, dirt, grass, harder trails. Mix it up. It distributes loads differently, stimulates broader adaptation. Avoid just pounding on hard surfaces all the time.
Makes sense.
Number three, adequate rest and recovery. Non-negotiable. Between workouts, between competitions, and definitely give them an off-season break for that crucial bone remodeling.
Let the body catch up.
Yes. Fourth, optimal nutrition. Balanced diet, correct calcium to phosphorus ratio that's vital enough, copper, zinc, vitamin D, electrolytes. The building blocks have to be there.
Fueling the machine properly.
Precisely. Fifth, excellent hoof care and shoeing. Regular farrier work, keeping feet balanced, maybe protective pads on tough terrain. It all affects how forces hit the leg.
Foundational.
Literally. And finally, number six, early detection of lameness. Owners, riders need to be hypervigilant. Notice those subtle changes.
Don't ignore the small stuff.
Never. Get regular vet checks, even for minor issues. Because, coming full circle, that horse that isn't quite sound enough to train or compete without painkillers,
Yeah.
that's the horse at serious risk of a major fracture. Prevention really comes down to listening to the horse and respecting its limits.
This has been incredibly insightful. It really paints a picture of this delicate balance between pushing athletic limits and respecting the horse's physiology, that resilience, but also that vulnerability.
It does, and it leaves us with a really important question, doesn't it? In a sport that's all about pushing equine endurance to its absolute peak, how do we keep finding that balance? How do we prioritize performance while safeguarding bone health and the fundamental welfare of these amazing animals?
That's the ongoing challenge. And for you, listening, think about how these principles resonate beyond horses. Bone adaptation, gradual conditioning, the importance of recovery. These aren't just equine concepts. Whether you're thinking about athletic training, maybe tackling a big project at work, or even personal goals, that idea of progressing steadily, resting properly, and paying attention to the subtle signs, well, those principles are pretty universal, aren't they?